Paid menstrual leave. Should it be a legal right for every working woman? Recently, the Supreme Court of India refused to make it mandatory to provide menstrual leave, and that has triggered a huge debate. But did the court actually reject menstrual leave, or is there something more to the story? Let's break it down. So, what exactly has happened? Recently, a petition was filed in the Supreme Court asking for paid menstrual leave to be made mandatory for all women in workplaces and educational institutions. The Supreme Court simply declined this request. What is important here is that they have not banned menstrual leaves. This is not a blanket ban. This is not a no to menstrual health of women. In fact, the court has simply said that it cannot be a decision imposed by the courts. It is a policy decision to be made by the governments. Okay, the court gave some practical, yet I say controversial reasons. One, the impact on employment. If the companies are forced to provide menstrual leave to women, will it affect the hiring process? Will less women be hired in companies? This is uncomfortable, but very real in a competitive job market. Second, the risk of reinforcing stereotypes. Will this label women as less capable during periods? But I'm not here to talk about politics. I am here today to talk about something far more important. Are we normalizing women's period pain far too much? Every month, millions of women go through severe pelvic pain during their periods. Most of them are told it is just normal. Just go and take a painkiller. It will just pass. What if I tell you today that severe pelvic pain during periods is absolutely not normal? Or it means that mostly there is something which is underlying, a serious condition that is affecting the pelvis. Instead of debating only about menstrual leave, we should ask ourselves a few questions. Why are so many women in severe pelvic pain during periods? Why is the pain so severe in some women that they can't even get up? They are lying down all the time, they can't go to school, they can't go to work. This brings us to an often ignored condition called endometriosis. Since this is Endometriosis Awareness Month, let's talk about endometriosis. So let us understand the condition called endometriosis. In endometriosis, what happens is that the lining inside the uterus starts growing outside the uterus in ectopic places like the fallopian tubes, the ovaries, the intestines and the rectum, and sometimes even the bladder. So every month when the woman bleeds, this tissue also bleeds inside the body. But there is no place for this blood to go. So it normally gets collected in the same place, and ultimately it will result in chronic inflammation, adhesions and severe pelvic pain. Red flag signs that you should never miss. Severe pelvic pain during your periods that prevents you from doing any activity, that prevents you from doing your work, going to school or doing your routine activities. Pain that is persisting even after your periods. Your periods are over but the pain is not going, then that is when I will suspect probably there is endometriosis inside. Thirdly, difficulty in conception. Endometriosis tends to affect the tubes sometimes, distorts the anatomy, pulls together the ovaries, and as a result people find it very difficult to conceive. And fourthly, deep pain during having sex or intercourse. Deep pelvic pain every time there is a thrust. That is highly suspicious of endometriosis involving the pelvic ligaments. Remember, if pain is forcing you to miss work, forcing you to lie down during your periods, and not allowing you to do your regular work, at the same time severe pain not responding to any simple medications, then this pain is absolutely not normal. One of the biggest problems that I see in my practice is that women will tolerate pain for years without complaining. Society will normalize it, family ignores it. In the end, the woman keeps suffering, and the diagnosis gets delayed by 5 to 10 years. That is totally unacceptable. If you or someone you know has got severe pelvic pain, then it is time you rush to a gynecologist. Please do not ignore your pain. Go and meet a gynecologist. Start evaluation. The first step that a doctor will take up is do a thorough pelvic examination and at the same time get an ultrasound scan done. If not diagnosed with this, then you may need a MRI scan or in some cases a diagnostic laparoscopy. Because early diagnosis can reduce pain, protect fertility and improve the quality of life. Yes, menstrual leave debate is important. But even more important is this. Menstrual pain should never be normalized. This Endometriosis Awareness Month, let's spread awareness about endometriosis. Severe pelvic pain may not just be a symptom, it may be a condition waiting to be diagnosed. So go see your doctor today. If you find this helpful, do share it with someone who feels period pain is normal. And do follow us for more women health related content.